That was Wappingers. What we know from law enforcement, actually from discussion with Congressman Maloney's office, is that it will formally be made public that actually on the heels of Senator Schumer, who was visiting Poughkeepsie, I think, a few months ago. He had a press conference in the town of Poughkeepsie, and what he was pushing for at that point in time was to designate particular regions in the Hudson Valley as high-intensity drug trafficking areas. Westchester, Rockland, and Orange already have those designations, but those designations were attached to violence. Putnam and Dutchess will soon be designated high-intensity drug trafficking areas. It will be attached to a public health epidemic. That's different than the violence. That's not to say there is not violence associated with what we're seeing, but there's more recognition that this particular epidemic has to be addressed as a public health initiative. So stay tuned for that. We do know there's going to be, there already is ramping up of FBI and DEA presence in our area from an enforcement point of view. Can you forward the slide, Shannon? Again? Okay, what we're looking at is, as I mentioned, Dutchess ranks third behind Sullivan and Putnam. We know that prescription painkillers were sort of the catalyst for the move to heroin. There is differing opinion on the I-Stop legislation. And I think recently Mary Beth Pfeiffer did a pretty large article in the Poughkeepsie Journal talking about both of those issues. The reality is prescription drugs, for all intents and purposes, is synthetic heroin. And so something had to be done to address the escalation of the prescription drugs. And one of the questions Mary Beth Pfeiffer asked our agency was it the right move? You know, Monday morning quarterbacking is a hard thing to do. Something needed to be done. There had to be an intervention. Is there now a move towards the heroin? Yes, largely because it's cheaper and it's more available. The reality is that if you look back in time, dating back to the 1600s, the human condition has a propensity to use substances, whatever those substances may be. And that's not going to change going forward, folks. What needs to change is that the community is aware of the problem, and the community to some degree becomes the canary in the coal mine through coalition work that needs to be done at the community level. And that doesn't mean just our political leaders or just our school leaders. It means every sector in the community, because we all have a different lens on the problem, and 2, 3, 4, 12 heads are better than one. So if you leave here tonight, and I'm not dismissing anybody yet, the teacher in me says, no, class is not over yet. We need to leave knowing, and I think one of our panelists mentioned this, and it might have been Dr. Malvarosa, we all own a piece of this problem, whether we're the addictions doctor, the treatment professional, the parent, the folks in recovery, the school-based personnel, the faith-based people, the business piece of our community. Every single sector in our community is affected by this epidemic. And if we don't have everybody at the table, we're not going to get the best solution. So if anybody's interested, and is as eager a beaver as Anthony was on that Friday afternoon, or as Tom was when he called me, please see any member of CAPE staff afterwards, and we can lead you in the direction of the coalitions that are existing and that are forming, because we need your help. Now what I'd like to do is to open it up to questions, whether those questions be, verbal, you raise your hand. Yes, good. Many times we have these forums and people are afraid to raise their hands. Sir.
Yeah, I need to wait.
Can you come, would you mind coming up so we can all hear you, sir?
you're gonna be seeing a lot, like you see a lot of my 4-month-old daughter Cassie's mom soon, especially with Michael. Let me tell you something, y'all just start with a question, and I'll just say, if you would you tell me to shut up, because let me tell you something. I could definitely raise the level and the heat, what's going on here, because, I mean, Pat, you already, let me tell you something, Cassie's mom, she'll be the next one. She'll be part of the statistics in 2015. Right. If you Google Cassie's mom, listen, that was the secret for me, because she's in the system now, in the court system now. She was there in 2005. Okay, she ran the ER circuit, prescription drug circuit, pharmacy circuit, lost her son, then got him back, lost him again. Okay, and then she bumped into me 2 years ago. She's the love, but Cassie's mom's the love of my life. Listen, I just didn't know the secret until I got caught up with it in a year and a half. She was pregnant with my daughter, and then she proceeded to run the circuit, the ER circuit, 47 ERs during the pregnancy, 5 counties in New York State, 5 cities in Connecticut. All right? Went through Lexington. You'll be seeing her soon, Cassie's mom. Look, she tricked all you professionals. The only ones she won't trick are you, and you. Okay? Because dope fiend can't fool a dope fiend. Yeah, she's going to have some good words for you. Yeah, I remember you guys coming to our door. Yeah, I'm doing okay. Okay, and here I am. Yeah, I'm going to court now. Yeah, I'm the enemy to her, you know, Cassie's mom now, because listen, I exposed her secret. I had to pull the plug on it, call CPS. It's the most gut-wrenching thing to call CPS, you know. And really, I'm serious, the judge, CPS, they all should be embarrassed. They had her in 2005, and I have her again, and they really aren't that, like, because she's not Skid Row heroin. Okay? I mean, this is serious, like, the professional, and I guess my question is, what is the professionals going to do about it? I mean, how do you go? I mean, and then look in 2005, the same doctors, I was in the ERs arguing, and he walks in, and he just tell me, shut up, and you want me to shut up. I mean, you're talking about Cassie's mom goes into an ER, I mean, she's got a bad place, she's sick, go in there and tell them you're sick, and then, you know, it's about pain meds, and the doctors are arguing with the doctors, we're not going to give you this, and then they walk out, they come back, and they're, yeah, I stop, what? Yeah, they came in with the 3 or 4 sheets, yeah, we got your prescriptions, okay, you know, we recommend you go to, you know, get chronic pain treatment, then they walk out, argue with her, come back in, and I'll give you 1 dose of, you know, morphine on the way out the door. And then come back in, Danbury emergency room 5 times in a 2-month period. Arguing. I mean, they didn't even care about our 9-year-old son who's saying, please, no, don't kill my sister Cassie. Okay, then they bring in the sign, well, I'll have to have you sign a release form that you know that you're doing harm to your daughter and yourself. Sign it. Okay, that's Cassie's mom. You're going to be hearing about her a lot. Okay? This is the woman that loved the girl of my dreams. And this is what it is. I mean, like, I'm serious. I'm not trying to embarrass. These people should be embarrassed. The judge, I mean, you got to be embarrassed. She tricked you. What's going to trick you guys again, possibly? She won't trick him, and me. As I'm, you know, 99 recovering. She won't trick any of that. You know, I got caught up in the one part. I got caught up as the enabling, and they taught me in the rooms, you can't cure. I tried to cure my daughter's mother, and then I got caught up in enabling her until I pulled the plug. And now I'm the enemy. How dare you take my daughter? How dare you take, you know, try and take my daughter from me? Look, there's a lot of work that needs to be done on a professional level. I mean, I am not. This is what's going on, and you're going to hear about this. Listen, I'm like, you know, I'll be leading coalition somewhere. I mean, I'm losing my daughter's mother, the love of my life, to, I mean, not to Skid Row. I mean, we're talking about this. She did it. I mean, just passed through legally, like, backed by prescriptions. 5 counties. Yeah, the doctor, you're at the doctor. Well, I mean, it's probably the same doctor. I don't know, in Westchester, this doctor, this is, you know, I'm going to be quiet, because I can't make this about me. It's got so bad, okay, 1 month prescription, down to Ardsley, get your prescription, come back with Dilaudid or morphine, 120 pills in 4 days. Well, listen, listen, she's smart. You go down to RZ again, the doctor changes it from 30 milligrams to whatever milligram, you can go fill another one, because it's a different milligram. Then it's on again. Oh, geez, you gotta go again? Yeah, I'm out of my prescription. Go down there again. He tells me I can take more. Well, he tells me to take 2. Well, I added up on my calculator, it came out to about 18 pills a day. Go down again, get another one. This time it's Demerol, this time it's, and comes back with morphine and Demerol, then you go back and you switch the milligram. I'm the bad guy.
No, you're not the bad guy. This is an insidious disease. How many folks in this room who are willing to share this information have lost a loved one to this disease? Please raise your hand. I'm going to ask Mario and Michael. It is a disease, tell me guys if I'm right, okay? I'm coming at it from a personal point of view. It is a disease that has no cure, and it is a disease that is hard to get the individual to a place where they can manage it effectively and change the path they're walking down. Please comment briefly on that, and Anthony, Tom, and Sean, I would also like your input on that.
I do believe in the disease concept. When I look at a disease, I look at how it affects everything in the whole. The first part of a disease is the physical. So naturally, when somebody gets addicted, their whole chemistry in their brain, physiologically, everything changes. And the things that we try to recognize, as Dr. Malvarosa pointed out, is to get them off the drug and get them into a more healthier diet. So as the young man said, that his brain started to clear after a while, and then he could make some sound decisions. It's also what I realize about the disease is that it doesn't only affect the individual, it affects the family. And the family are the people that get wrapped up in the disease, and the roles that they play in the disease perpetuates the disease if they allow it. One of the things that the young man brought up, the gentleman brought up, was the concept of enablement. And with that process, when somebody takes away the things that they really love the most, which is the drug, there's also going to be some significant resistance in that area. So now the disease takes another shift and a turn, because now it's incorporating everything. Not only that, it affects their physical health, their work, their employment, their legal status, the families, the grandmothers, the mothers, the brothers, sisters, friends. So this disease is really on a scale that is pretty significant. And it's amazing to me, when I look at the whole thing, how much it incorporates the harm that it causes. From generations to generations, not just everybody in this room. So for me, when I really look at this disease, I look at that whole picture and how you're affected by it, and how Brendan is affected, and how I'm affected by it, and how the community is affected by it, and how we, as a, excuse me, have a responsibility as a community to continue to reach out to individuals. Let's face it, drug addicts and non-drug addicts are very intelligent people. They will get the drug if they really want it. And the thing is that it's up to us to provide for them the choices and the decisions that they need to make in order for them to move on. But we need everybody's help in doing that, including the medical professions, the roles of family. Everybody really needs to get on board, and I really want to value and stress the importance of community and the mental health associations as well.
So how, this goes to all panelists, and feel free to chime in, including you, Sean. How, one of the cries I heard, and I'm sorry, sir, I missed your first name.
Howard.
Howard, I think, is if I understood him correctly, is asking the question, how do we fill the gaps? How do we do this better? From the hat that you're wearing, any suggestions?
I'd like to just say something to you, Howard. You did the right thing, you're not a bad guy. Setting boundaries is the most important thing, and I don't know how to fill that gap. But the most important thing is the welfare of your child and yourself. Okay? And that's your responsibility. Okay, so what you can do is not enable and set boundaries to yourself, only to create a better situation. I mean, that's the bottom line. I had to do it as well.
And, you know, there's also other supports that are out there as well. Community self-help meetings, meeting Al-Anon, Alcoholics Anonymous, Narcotics Anonymous, Nar-Anon for families that are addicted to alcohol and drugs. These are all part of that community as well. So there is help. But it's work. It definitely is work.
Howard, I heard you mention perhaps a fleeting interest in coalition work. Please, if you have any interest in that, please see me after this forum, and perhaps we can talk about that, see where your interest lies. Thank you very much for your question. Are there any other questions? Holy cow, okay. Yes, ma'am. Sure, absolutely. Please just say your first name and then please give your question.
Good evening. My name is Sister Annette, and I would like to thank Sue Serino and everybody involved for this forum. I believe that the community itself is sleeping on this problem, and I'll give you an example. I think every neighborhood and every block, you should get to know your neighbors and get to know what's going on your block. We live on a very nice block. We have a fire chief, we have a police officer, we have somebody in politics. We had a burglary in the middle of the day, we had a drug arrest, we had drug paraphernalia all over the place, and about a week and a half ago there were 8 boys at 1:30 in the morning hanging out in the streets, and because one of my neighbors brought it to my attention, I called Detective Brisello on that. 1:30 in the morning, where are these parents? God only knows. So I think in order to help the problem of the community, everybody should get to know your neighbors, get to see what's going on. We had a lot of things going on the block, and I try to make the neighbors aware, people going in and out of a particular house, strange kids walking around, and you'd be surprised where that landed us. And I'm on the warpath to make sure that our block is safe and that the community knows what's going on. And I think if everybody does like a neighborhood watch on their particular block, you can help these poor police officers who are inundated with burglaries and drugs and everything else. So that is my message for everybody. I thank you. The Lord be with you, and God bless the police officers that go out every day and try to keep us all safe.
Other questions? Yes, sir. Come on up, so everybody just say your first, unless you want to shout it out.
Is it okay if I share a testimony?
Absolutely.
Okay. My wife was on Instagram, and she saw some other girls, and she did, everybody knows how the Valentine's candy, be mine. Molly's, they're going around the Haviland School, so she made these guys aware. They jumped right on it, put out a bunch of fires, and just impressive that we had these 3 guys over here, so that's what we need, so it's very impressive, so thank you.
I think the important messages in that is your family took action, much like this woman here is suggesting that has to happen. And the message at these forums is everybody has a piece of this. Other questions? Yes, ma'am.
I'm just like each panelist's opinion, and Sean also. What do you think about legalizing marijuana?
Thank you for asking that question. That's for me. Thank you. I'm waiting for the opportunity.
We're very glad that the MD in the room is handling that question.
Oh my God, that's all I got to say. I can't believe it. So we're suffering from an autoimmune disease in the whole country. It's like we're turning on ourselves. And this is kind of like an autoimmune disease where the individual doesn't act in their own best interest. Their nervous system is not serving them well. Your heart, if it pumps blood adequately, That's good. But if it doesn't, then you say that person has heart disease. Well, if your nervous system is not enhancing your survival in this life, there's a problem. And that's why it's hard to see, because it's a four-dimensional organ. Everything else about us is purely one-dimensional, biological. But this thing is biological, psychological, social, and spiritual, like I said before. Where am I going with this? All right. So, I have a problem with everybody. Politicians, my colleagues, my physicians, everybody. And for 28 years I've been polite. And I'm not going to be polite anymore. I'm going to be vocal, extremely vocal. I'm medical director of the prison. I do not speak for New York State docs, but I am the medical director. And over the past 4 years, I have a colleague in the audience, P.A. Youssef, I salute you. We started to notice cancer in people between ages of 28 and 32, cancer, lung cancer. And when we took a close look, we came to find what was the common denominator? Pot. Heavy pot use starting at an early age. And now we're still counting, we're at 6 now, right? 7. 7. And this is just us two. Now, downstate is a reception center, so we have the luxury of doing a chest x-ray on everybody as they're coming in. So that's how I happen to be in the vantage point. What I cannot understand is why I am not a researcher. I am one guy. And how come I'm seeing all these things and nobody else is seeing this? And, that's why I'm hoping I get the chance to address my colleagues at the Medical Society as well, because they need a shaking up. They need to hear. It doesn't mean that I'm right, but I want to be part of the dialogue.
Thank you, Mario. In the interest of giving everybody,
Yes or no, that's all.
what I'd like to do is I've got other hands in the audience, and I'm sure these folks would stay a little later. So if you want to ask that personally, I just want to be sensitive to everybody who's in the room and make sure I give everybody a chance to ask a question, but we'd be happy to answer them if you stay. Yes, ma'am.
Hi, I'd just like to speak on that subject quickly. I lost my son Justin, 33 years old, 5 years ago, to drug overdose, opiates. And I want to say that he started smoking marijuana when he was 12 or 13 years old. Michael did say that we have to educate people on having a genetic predisposition to be addicted to drug, problems like that. That is in my family. Had I thought of that at the time, maybe things would have been different. But when Justin went and had rotor cuff surgery and he was put on the opiates, he became addicted, and I lost him.
I'm sorry for your loss. Any other questions? Yes, ma'am.
I'd like to address this to Regina. I'm a mother of 3, a grandmother of 4. When I was raising my own kids, we really didn't have that much time with them. You're just getting them. Okay, so my grandkids, I tend to listen to them when they come over and they're talking. And what I found was that it's a big shock when they go from grade school into junior high. I mean, it's a big shock. You're talking about a whole lot of different things that they come with, peer pressure, doing well in school, plus a lot of social, interaction, and also awareness of drugs and things. I think that you may have to start on a very small level, in the grade school, say the last year, to make them aware of where they're coming into junior high. I think
I'd like to, without your knowing it, ma'am, you hit on the tagline that SAMHSA has put into place over the past several months. And that is, it's directed to parents and grandparents, and it is a message called Talk, They Will Listen. So, and you used all of those words. So, I think you should call SAMHSA tomorrow and ask them if they have a position for you. That being said, You're exactly right. One of the challenges we have is, which actually Marty made reference to earlier, is funding. When the bottom fell out of the economy, every sector of our economy got hit. Schools, human services, across the board. Also, the stigma that Anthony made mention to in his keynote is alive and well. And with that being said, sometimes school districts, and I speak as someone who worked in a school district, and Mandy, I hope you'll join me in this, school districts get fingers pointed at them for everything in the book. Now, while we all know substance abuse happens everywhere in a community, a likely finger pointing is going to happen in the direction of the schools. That's an uncomfortable place to be in because they don't own the entire problem. Neither do our law enforcement officers, neither do our treatment providers. If there isn't a collective collaboration that addresses this epidemic, then the outcomes are going to be less successful. That's the bottom line. We all live in Dutchess County, or I think most of the folks here do. And if we don't take an active role in finding out how we can contribute to the solution, it will be a less than successful solution. Any other question? Yes?
Hi. My name is Sarah. I'm a psychology student. And I have a question for Mario and Michael in the terms of psychology. I'm interested in studying addiction and family systems. And I've come to the understanding that addiction is mostly a symptom of unresolved issues within the family. Am I correct? And the theory of the family system states that the most vulnerable person within the family takes on those unresolved issues, and it mostly aids in the addiction. Am I right on this, or can you elaborate more on this?
There's books and then there's real life.
Yeah.
Like I said, I stumbled into this field. I was doing psych evals on everybody coming into the rehab, and I did it from a medical model. And one thing that really jumped out at me was the family history part. It was interesting that, now I'm talking over about a 4-year period of time, what I found fascinating was that half of the people coming in, their parents were fine. But there was an uncle, an aunt, a grandparent. There was family history. It was still, even though mom and dad might have been okay, it was in there. And it seemed to me, what's genetic? What could be the genetic piece to this? Well, what I came to see is that there seemed to be 6 areas. And it seemed to be alcohol, drugs, but then there were other areas that were problematic with these people. Food, some were overeating, some were undereating, a lot of candy, sex, gambling, taking risks, and emotions and attitudes. So there were 6 areas, and I looked at this. Not everybody had these 6 areas as a problem, but some had 2, some had 3, some had all. But the common denominator is that these were all stimulating things. And I thought that was interesting. The other interesting part was many of them, like Pat had mentioned, many of them, now back then, there was no ADHD. They called it minimal brain dysfunction. There was a lot of inattentiveness or easy to be distracted. They all had that common denominator. What I'm trying to get at is, I think there's a physiologic basis for this. And it's real. And I think if you're looking at, maybe it could be grandpa or an uncle, this pretty much makes this everybody's problem. Everybody's potential problem. We all need to look at ourselves and our families and realize that there could be also something, it could jump generations. So just to explain it, again, the 4 dimensions, just to explain it purely on a psychological level, is it part of the problem? Could it be? Yes. Solely? No. I would look at the 4 areas.
I
You talk to me later as well, I'd be happy to.
I want to be deferential to everybody's time. Since we started a little later, we went a little later. But when I talked to Sue Serino and Patty Holman, we wanted to be tight with the time because we know it's Sunday evening, we know you got work, school, whatever tomorrow. And we don't want you to leave here saying those darn people, they didn't stick to the time and they kept us too late. So what I'd like everyone in the audience to know that we're panelists are going to be here a bit longer. So if you'd like to come up and ask one of them a question, please feel free. And what I'd like to close with is the following. We know that Congressman Gibson has made an amendment to the House Appropriations Bill on Thursday, which passed, putting more money for anti-heroin activity, more police and surveillance on the streets. Congressman, could I twist your arm to come up and just embellish on that a little bit?
Actually, this relates to what you mentioned to earlier, and that is the closer collaboration between federal, state, county, law enforcement officials. And so, this is the federal funding piece of it that goes together with the state and local that's really aimed at trafficking, at significant trafficking and also gang-related activities. So this is one piece of it. This was an increase in that funding. There were some other lines that were also increased. The COPS grant was also increased. So, but as I mentioned at the outset, there's so much more than just enforcement. Enforcement's important. It's a key piece of it to show deterrence and competence. But prevention, what you're doing here today, and the theme of all of us in this together, man, I think that is so incredibly important. It's encouraging, the way that everybody communicated with each other, how candid, how frank, how compassionate that everybody was here. That prevention, the enforcement, and the treatment piece of it, and I'm finding some of the same things, except there's a variegated set of outlets, and in terms of approaches, and in terms of outcomes. So I think that that's something going forward. We might benefit from a little bit more at the treatment level sharing and potentially bringing more standardization to treatment, at least in terms of, there's such a wide array right now. Some treatment regimes are 3 days, some are a month, and there's various levels of outcomes based on that. And so I think we're all going to learn that. I suspect we're going to learn that piece of it too. But, thank you. Thank you so much for your leadership here. And there's more to do. There's much more to do, but I think we're at least moving down the right path. And we'll continue. Thank you. Thank you.
So as I promised, anybody who wants to scoot can scoot. There are still some refreshments left. Anybody who wants to hang back and ask some questions. I would like to thank Sue Serino, Dutchess County legislator, and Congressman Gibson for their support and also for being instrumental in driving this forward, because when you look at the Community Anti-Drug Coalitions of America, which is the coalition work that CAPE does, probably the single greatest influencer in the kind of change that we made is policy. And it doesn't happen overnight, and it doesn't happen without the voices of everyone in a given community. Your political folks need to hear from you if there's something you expect from them. They don't have magic, they don't have crystal balls. Sometimes problems emerge silently over years and then explode. There is some degree of that associated with this. All that being said, if everyone's not listening and everyone is not talking, this problem won't go away. Thank you so much for coming out on a Sunday evening.
But I'll see you tomorrow at the he's back for the next year. He's back for the next 9 days. Tomorrow is let me see. There's a Hudson Valley, this AFL interview? It's a reception. Not a receptionist.
I don't know what that is.
Tomorrow is the 2nd.
Yep. Yep. Yeah, it's gonna be a busy week, man. We're gonna be flying around. Can't wait till it goes back to DC.
Yeah. Tell me about it.
You're in the same boat I am.
Yeah. I'll
DC and, you know, chill.
Yeah.
Gee.
Maybe we could schedule a 9 at the golf course when we're back in Houston.
Yeah, I hear you.
Yeah. All right.
See you tomorrow.
See you tomorrow.